Welcome to this video where we'll delve into the often uncomfortable but surprisingly common condition known as pruritus ani. This literally translates to itching anis, and while it might not be a pleasant topic, understanding it is crucial for those who experience its persistent discomfort and those who seek to help them. So, what causes this relentless itch? The causes of pruritus ani are diverse and sometimes difficult to pinpoint. It can be primary, meaning it arises on its own without an identifiable underlying cause, or secondary, resulting from another condition. Common culprits include poor hygiene, where insufficient cleaning leaves irritating fecal matter behind, and excessive hygiene, where vigorous scrubbing with harsh soaps strips the skin of its natural protective oils. Other contributing factors can be hemorrhoids, anal fissures, skin conditions like eczema or psoriasis, fungal or bacterial infections, certain foods like caffeine, chocolate, citrus fruits, and spicy foods, medications such as antibiotics, and even stress and anxiety. Tight clothing and obesity can also exacerbate the condition. Understanding how pruritus ani develops involves considering the delicate skin around the anus. Irritants, whether physical, chemical, or infectious, disrupt the skin's barrier function. This disruption triggers an inflammatory response, leading to the release of histamine and other inflammatory mediators. These substances stimulate nerve endings in the skin, creating the sensation of itching. The itching, in turn, leads to scratching, which further damages the skin, perpetuating a vicious itch-scratch cycle. This cycle can lead to chronic inflammation, thickening of the skin, and increased sensitivity, making the area even more prone to itching. Pruritus ani is a relatively common condition, affecting both men and women, although it tends to be more prevalent in men between the ages of 30 and 50. While exact numbers are hard to come by due to the embarrassing nature of the condition and reluctance to seek medical help, it is estimated to affect a significant portion of the adult population at some point in their lives. People with pre-existing skin conditions, certain dietary habits, or high stress levels are considered at higher risk. The most prominent symptom of pruritus ani is, of course, intense itching around the anus. This itching can be intermittent or persistent, and it often worsens at night. Other associated symptoms might include burning, soreness, irritation, redness, and even thickening or whitening of the skin around the anus due to chronic scratching. In some cases, small skin lesions or fissures may develop as a result of the constant irritation. The persistent itch can lead to significant discomfort, anxiety, and sleep disturbances, impacting a person's overall quality of life. Diagnosing pruritus ani typically involves a thorough medical history and physical examination. Your doctor will ask about your symptoms, hygiene practices, diet, medications, and any underlying medical conditions. A visual inspection of the anal area is crucial to identify any visible skin changes, such as redness, inflammation, fissures, or signs of infection. In some cases, further tests may be necessary to rule out underlying causes. These can include endoscopy to examine the anal canal, skin biopsies to evaluate suspicious lesions, or stool samples to check for infections or parasites. Allergy testing may also be considered if a specific allergen is suspected. While pruritus ani doesn't have strictly defined classifications, it's often categorized based on its cause. As mentioned earlier, we distinguish between primary or idiopathic pruritus ani, where no specific cause is identified, and secondary pruritus ani, which stems from an underlying condition. Identifying whether the condition is primary or secondary is crucial for effective management and treatment. Managing pruritus ani involves a multi-faceted approach aimed at relieving the itching, breaking the itch-scratch cycle, and addressing any underlying causes. First and foremost, gentle but thorough hygiene is essential. This means washing the anal area gently with warm water and a mild, fragrance-free soap after each bowel movement and patting the area dry. Avoid harsh scrubbing and perfumed products. Topical corticosteroids, prescribed by a doctor, can help reduce inflammation and itching. Other topical creams, like barrier creams containing zinc oxide, can protect the skin. Avoiding potential irritants in your diet, such as caffeine, alcohol, and spicy foods, can also be beneficial. In cases of infection, antifungal or antibacterial medications may be prescribed. Stress management techniques, such as relaxation exercises or yoga, can also help reduce itching triggered by anxiety. In severe cases where conservative measures fail, surgical options may be considered, but these are rare. Preventing pruritus ani involves adopting good hygiene habits and avoiding potential irritants. These are some basic steps. Gently clean the anal area after each bowel movement. Use soft toilet paper and avoid excessive wiping. Wear loose-fitting cotton underwear to allow for better ventilation. Avoid using harsh soaps, perfumed products, or douches. Limit caffeine, alcohol, and spicy foods. Manage stress and anxiety through relaxation techniques. Treat any underlying conditions, such as hemorrhoids or eczema, promptly. Maintain a healthy weight to reduce friction and sweating in the anal area. The prognosis for Pruritus ani is generally good with proper diagnosis and management. Many cases can be effectively controlled with conservative measures and lifestyle modifications. However, chronic or severe cases may require more intensive treatment and may be more challenging to manage. Recent research has focused on identifying the role of specific inflammatory mediators in the pathophysiology of Pruritus ani, which could lead to the development of more targeted therapies. Additionally, studies are exploring the potential benefits of probiotics in restoring the gut microbiome and reducing inflammation. Continued research is crucial for improving our understanding of this condition and developing more effective treatment strategies.